you struggling with bumpy texture on your forehead or maybe your cheeks or chin that just can't be hidden by makeup? Then you might be experiencing closed comedones. So firstly, what is a closed comedone? A characteristic feature of closed comedones is this flesh-colored, bumpy appearance with no inflammation that may or may not be happening in context of experiencing acne or blemish-prone skin. Now, the best way to think of a closed comedone is as traffic congestion. So if we think about the pore, it's like a tunnel, and passing through that tunnel are dead skin cells and oil. Now, when traffic flows smoothly, there's no problem. But when traffic backs up, those dead skin cells and the oil congest, you get a blockage. Pressure builds up and leads to a bump on the surface of the skin. Now, the next thing to know is how to distinguish closed comedones from open comedones. Now, open comedones are perhaps more commonly known as blackheads because the end of the pore that's blocked is open to the air, and the matter that's blocking up the pore gets oxidized. Whereas in a closed comedone, this is sealed off and protected from the external environment. Now, blackheads, often seen in the nose where we have the most oil production, are often fairly benign, hey Hector, in that they don't tend to lead on to inflammation and blemishes, papules, pustules, cysts, and so forth. Whereas the pressure building up behind a closed comedone lends itself more to inflammation. There's a blockage that allows oil to collect, and then the acne triggering bacteria, C. acnes, can have a little party in the pore, and that can incite inflammation, which means you might end up with a bump that's red. You might end up with a red bump with a white top, that's a pustule, or you might get a large lump going down into the dermis that forms a cyst or a nodule. Any of these things can happen, and it's why it's really important to get control of your closed comedones. So where should you see closed comedones? Now, typically they occur where there's oil. So that's typically the forehead, the nose, and the chin. However, in adult women, we do tend to often see them along the sides of the face, in the lower jaw and lower cheek area. Now, the reason for this is likely because the sebaceous glands in the cheeks are more sensitive to changes in stress hormones like cortisol, and also the hormones associated with the premenstrual period just before your period. So raised testosterone and progesterone. But in general, where there's oil, there might be closed comedones. Oh, hey, bunny. The next thing I want you to know is that comedonal acne is not inflammatory. So that means these are quiet. They don't look red and angry. They're not sore and tender. But as I said before, the congestion in the pore can lead to inflammation later on, which is why we should be strong in tackling our closed comedones. Now that comes to the next point, like why we shouldn't squeeze or pick closed comedones. Now remember, there is no pus there. Pus is only present when there is inflammation. Pus contains dead white cells. Now, there is no pus in a closed comedone. So when you're poking away or using devices to try to extract them, remember, there's really nothing in there that you can get out by manually attacking them. Leave that to professionals. Now, whilst we're on the topic of things to avoid, one of the big no-nos if you're prone to closed comedones is smoking. Smoking increases the stickiness of the skin cells and the oil and just tends to make your comedones worse, both in terms of the number of them and how extensive they are on your skin. So it's just simply a no smoking rule when it comes to closed comedones. Similarly, thinking about your diet, again, moderating sugar. We know sugar provokes spikes in cortisol, the stress hormone, spikes in insulin, and tends to increase the possibility of congestion in your skin. So do bear that in mind. Now, coming on to skincare ingredients to look for when it comes to tackling those pesky closed comedones, I think of them in two groups. So the first group tackles the existing closed comedones you have now. So that's ingredients that basically help dissolve those little plugs and exfoliate within the pore. Now, things that work well for this include beta hydroxy acids like salicylic acid, look for 1 to 2%, and azelaic acid, which is less of an exfoliating acid and more an ingredient that helps regulate cell turnover and reduces the stickiness of those skin cells. Other ingredients that also help unclog your pores include benzoyl peroxide, and I don't tend to go higher than 5%. Even 2.5% is sufficient in many instances. This also helps dissolve existing comedones. Now, things that don't particularly help that people often reach for are the group of acids known as alpha hydroxy acids, for example, glycolic or lactic acid. And this is because they are water soluble. To get into the oily pore, you need to be oil soluble. This group of ingredients is what we call secondary comedolytics. And that's just a fancy way of saying that it gets rid of comedones after they have formed. But for a routine to be effective, we actually want to prevent them in the first place. And that's where we need primary comedolytics, meaning they help prevent them from forming at the root cause. Now, the group of ingredients that does this brilliantly is the retinoid group. And that's because they help normalize the attraction between those skin cells that tends to make them clog up in the first place. Now, all retinoids will have that property. That's one of the kind of primary things they do for your skin. But the stronger the retinoid, the more effective they're going to be at helping prevent comedones. So if you are someone who's struggling with a large number of comedones, you're probably going to want to look in the prescription retinoid space. And in the UK, that means ingredients like adapalene or differin or all-trans retinoic acid or tretinoin. Those are the two I use most commonly in my clinical practice. However, it doesn't mean that over-the-counter retinoids won't work. They just might take a little bit longer. But of course, for those of you with sensitive skin, you might actually find that much easier to stick with in the long term, particularly if you're managing this yourself. Ingredients like retinol, retinaldehyde, and granactive retinoid will all make a difference. Similarly, azelaic acid, which has a lot of overlap with the benefits you'll see with retinoids, will also help, and again is great for those with sensitive skin. So for many of my patients who are really prone to closed comedones, I'll actually want to build both retinoids and azelaic acid into the routine, and then sprinkle a little salicylic acid on top if their skin can handle it. But at the end of the day, prevention is absolutely key if you want the peace of mind of knowing that you're doing the most to prevent them from happening in the first place. Now, the next thing to think about is doing no harm. And perhaps this is an area where we have the most potential to make a change with really the most simple interventions, and that's about avoiding using provocative products. Categories like facial oils, balms, long wear makeup, and even setting sprays and powder can all contribute to the formation of closed comedones. The more occlusive, perhaps anti-aging style moisturizers that are not being formulated with clog-prone skin in mind. And I see this all the time. The term comedogenicity is not a precise one. However, I do feel that companies that produce skincare products that go to the bother of labeling their products in some way in relationship to whether they are comedogenic or not, it tells you something about the way they've been formulated with the consideration in mind of somebody who is acne prone. So we certainly at Dr. Sam's formulate with this intention 100% across the board through all our products, as do brands like La Roche-Posay, Aven, and Bioderma. So brands that are sensitive to the fact that grown-up women are frequently still breakout prone, even when they're tackling fine lines and wrinkles. So for me, that's a really key way to go about choosing your backup products. There's no point in using the best actives in the world if, on the other hand, you're using ingredients in your skincare and your makeup that's actually making you kind of walk uphill fighting this battle. So be ruthless. And if you notice patterns across different product categories, be sensitive to that. If something you suddenly introduced because you saw it on Instagram or TikTok, or your friend recommended it, and all of a sudden you start seeing bumpy texture in your forehead, pay attention. Other categories that I know can sometimes cause problems, anything with coconut oil in, and some of your hair care products. So I always urge patients to do their skincare after they finish their shampoo and conditioner. And if you're leaving a conditioner on the ends of your hair, you have long hair for a while, pin your hair up so it's not sitting on your shoulders. Another area where, again, we can see the tendency for closed comedones. The upper back, the kind of V of the back, is one of the most congestible areas because it has the highest density of oil glands. And similarly with the chest, the V at the chest at the front, which is often quite sensitive and can therefore be a little difficult to treat. So if we can prevent these things by avoiding simply products that shouldn't be in contact with our skin being on our skin, then that's just the best situation. Last couple of points. Patience is key when it comes to treating closed comedones. I want to be realistic with you. I want to tell you that this is a relatively long road ahead if you have quite a few closed comedones. It's not uncommon for someone to have 20, 30 and beyond closed comedones, particularly if you're an adult woman who's prone to problems in the lower face. And therefore, you have to set realistic goalposts. Otherwise, you're just going to end up disappointed. Remember, happiness equals results minus expectations. So with closed comedones, we know that it can take time. And I'm thinking in the order of months, certainly not weeks. And it can sometimes cause a purge. And what purging is simply the fact that when you push out those comedones, sometimes if you're prone to inflammatory lesions, you might find that it ruffles up your acne. So if that's happening to you, it often happens at around 2 weeks to 4 weeks into starting to treat the problem. Go watch my purging video so that you know what to expect and what to do. And then finally, if you're still struggling despite this advice, or it's happening in context of significant inflamed blemishes, or you're getting scarring, so it's, leaving these potentially permanent marks on your skin, or it's just causing you an awful lot of distress, then do go and get some help, because at the end of the day, prescription skincare will give you something extra. It might be that you even need procedural intervention. Sometimes in the office, we'll use an electrical current in the form of electrocautery to help open up those closed comedones, and it allows the retinoids and azelaic acid and other ingredients to work a little more effectively sometimes. So there are other things we can do. Sometimes you'll also warrant, oral medication because you're getting significant inflammatory lesions. So looking at your skin holistically through the professional lens can really make a difference. So if you're seeing those warning signs in the skin, or you're just feeling like it's all too much and your skin is out of control, please do go and get some help. So for something that looks relatively innocuous on the surface, there's really quite a lot to closed comedones. So I hope today's video has helped educate and enlighten you as to what's behind these little bumps and what you can do to prevent and treat the ones that you have. At the end of the day, I want you to get the clear, bright skin that delivers peace of mind, allowing you to go about your life without worrying about what's going to creep up on your skin tomorrow. So if these tips have been helpful to you, let me know in the comments. And if there's more on closed comedones you'd like to hear about, let me know. All right, guys, bye for now.